So my name is Nuha Arefin. I'm originally from Dallas, Texas, where I went to UTD for undergrad and majored in neuroscience and minored in visual arts. I'm now a third-year medical student at Dell Med here at UT, where as part of our third-year curriculum, I did the Master's in Design and Health. So Compreva was originally Project Resilient, which was our capstone project as part of our Master's in Design and Health. It was initially brought up by Dr. Pena, who is a dermatologist specializing in HS, and she's been working very closely with HS patients, HS being Hidradenitis Suppurativa. She works very closely with these patients and noticed that there's a gap in products regarding like clothing or just garments or in general, like currently the treatments, like the navigating the daily life has been very difficult, and these patients have like a really difficult quality of life. And so she came to the design department and asked, how can we find a solution for this? And so thus Project Resilient was born, and me and some of my classmates, which were also like fellow design peers, where we kind of explored, further interviewed these patients and really try to learn about their what their pain points are, what are the struggles that they're having with when it comes to like clothing and daily life. And we found that, managing these lesions, which is essentially like non-stop leakage, is coming out of areas of skin folds that you can't really stop. So we learned about that, and then we started designing this product, and eventually we got accepted as part of the Texas Health Catalyst and became a business. Now Project Resilient turned into Compreva LLC, and we're continuing to do some research and development onto this product. So now, it's very difficult to create a garment when you want to have breathability, but you also need compression. A lot of these things that we've learned that were important design elements seems conflicting at times, and we're still working through it. But there's actually multiple components into making a garment where we have learned, and we are not experts in this. A lot of my team members come from different backgrounds of like engineering, I'm from medicine, graphic design and things like that. But fashion and fabric is such like a whole new realm where that was something for us to learn about. Fabric is so important for this garment, especially with patients with HS, is the types of garment they can wear that won't further irritate their skin or further cause flare-ups of their, worsening their condition. And so keeping in mind of how do we do that that's soft and breathable, but we also want to hold in dressings in place and have that compression aspect. And so it's a lot of like figuring out one or the other. There's other just in general not having the background information, and I'm having to do a lot of research myself and a lot of learning when it comes to fabric, but also HS itself and the functionality of it, the functionality of the garment, and the different components, also making sure that this is still patient-centered. So going back to the patients, thinking about cost and production. And so it's very multifaceted. We're learning like there's different areas of research that we're doing that we don't really have that information or background originally. We're not experts, but we're learning a lot and we're moving really fast, and we've been collaborating with incredible people. We have a fashion designer on our team who is a mentor from the Texas Health Catalyst, Michelle French. She had joined our team and has provided her knowledge about fashion and fabric. And so her with Dr. Pena knowing that like actual medical information regarding HS and combining that and designing this, it's been such a great and interesting collaboration, and where I truly feel that that's where like art and medicine is meeting, and that intersection is happening. I think the most exciting thing is actually creating the prototype. We have created a prototype as part of our capstone project, but we have advanced so far with our research and the design elements. And so we're actually working with a manufacturer and a mill to actually create all of the information that we've done and create an actual like garment that can fit a patient. And I think that is the most exciting thing, is to see all of our hard work and all of the research we've done in the past year kind of come to life into like a physical prototype. Would be a point that we can a tangible aspect of we have reached a goal of our first milestone. So I think that'll be really exciting.